So I'm going to start with a little bit of a presentation of myself and WISH. I am Tiffany Chapathy, the WISH chairperson. With me are Daryl and Whitney from the Foundations Department. So what is WISH? WISH stands for Women Investing in Samaritan Health, and it's a branch under the Good Samaritan Hospital Foundation. WISH was founded in 2004 and is open to women and men interested in supporting the health needs of women and children in the Corvallis area, both their physical needs and their mental health needs. Each year we review grant submissions and vote on funding requests. To date, we've granted more than $414,000 in funding, which includes fetal monitors, books for children wellness visits, teen and family support activities through the Boys and Girls Club, the Arts Care Program, lymphedema garments and wigs for cancer patients, and remodeling a portion of the Good Samaritan labor and delivery units. In addition to this, WISH sponsors events to bring together women locally for fellowship and networking and for educational events focused on women's health topics. In 2021, we also helped in sponsoring a clothing drive for the hospital's Compassion Closet that helps folks that don't have clothes when they leave the ED and other areas. And in addition to that, helped with funding or supporting community outreach programs as well. And we continue to find ways to meet virtually during COVID. That's been a challenge, definitely. It should be mentioned that there's another women's giving circle, the Pacific Communities Health District Foundation. They support healthcare for women and children within the context of patient care at the Samaritan Pacific Communities Hospitals in Newport. And you can find out more about their generous community of women at samhealth.org. A little bit more about the WISH Giving Circle. There are 3 ways to be a part of this. One is to join or renew your annual membership, which is split into 2 amounts based on age and is tax deductible. Or you could gift a member sponsorship for somebody else and cover their annual membership commitment. Our members participate in site visits for those funding requests, vote on the funding request, and receive invitations to special events. Another way is to do online donations. We accept those in any amount, and 100% of the funds is donated into our funding pool to be used 90% next year and 10% to the endowment, which generates interest. So if you're interested in becoming a member, visit us at samhealth.org/giving and select the Good Samaritan Hospital Foundation. All donations or memberships received by the end of the year will be available for giving in the next calendar year. You could also be active for grant requests, much as Jeremy and Brooke have done today. We have a grant submission process that's available on the SHS Insider and underneath the Foundations Department page. All grant submissions are due in the January timeframe, excepting probably starting coming up in November. All right, today's show and share presentation highlights the Samaritan Pediatric Therapy Program as recent grant recipients. We have Brooke Miranda, who is an occupational therapist, who will be sharing information on how she uses a Rifton Activity Chair for providing adaptable seating for children for optimal function. And Jeremy Wren is a physical therapist who will present information on a functional movement screening that can enhance the routine physicals for youth sports activities by setting a baseline for key movement functions. All right, Brooke, I'm going to turn over to you and let me know when you're ready for the video.
Thank you all for being here. As Stephanie said, my name is Brooke Miranda, and I have been the pediatric occupational therapist for Samaritan for a little over 5 years now. When I came into the program, I inherited some equipment and wanted to, do the best that I could for our population, which serves actually our 5-hospital area. I get children from Lynn, Lincoln, and Benton counties, and we service any and all occupational therapy needs for visual, motor, fine motor, integration, coordination, attention, you name it. We have been working with them well for the past 5 years. And one thing I noticed was that we didn't have enough seating options for our children, and I was trying to put them in the closest thing that I have, which you'll see in the video in a minute, and then sometimes I was having to reach around them or wedge things, and all trying to get them to be the most optimally supported so that they could do whatever play task they needed to do, or handwriting, or even self-care that they were trying to learn. And so I started doing some research and was really fortunate to find that Samaritan had this WISH opportunity, and did some research on the Rifton Activity Chair, and it has made a wonderful difference with our patient population. It has been used for more kids than I initially even thought possible, because it is a completely adjustable chair for children. I have used it for children ages about 2 to 3 up to 12, and they have I can adjust the angles and the height to give them the optimal support. So kids who have motor deficits, but even kids who just need to be properly supported in a chair at the best position. I know you guys can kind of think about when you work at your desks, you don't want your feet dangling the entire time or constantly fidgeting, because it impedes your ability to work. So we have used it with a wide variety of children, and it has been a great asset to our clinic. And now, Tiffany, if you'll go ahead and play that link for us. This is one of our, this is actually one of my patients who has greatly benefited from the chair. Since our audio is not working, you can see just how by tilting the chair forward, she's actually getting a more upright position. The first part was actually showing the previous seating position. I've been working with this patient for a couple years now, and so she's actually gotten a little bit taller, and the previous seating was more difficult. But you can see the postural change in having her head all the way down to now being able to be more upright and supported on the sides with those lateral supports, so that she can actually focus on what she needs to do with drawing.
Brooke, did you say that the sounds were not coming across?
The sounds were not coming across.
Okay. I'll work on that before Jeremy's presentation.
Okay.
See if I can figure that out.
But that's okay. I can cover in with just a general description of what we saw Miles doing. She did want to make sure that she said hi and thank you in that video. So that's probably the only really cute sound. The rest is just me talking. So
yeah, I really like in that video how we can see the range of motion and the way that you're able to configure it for her size. So yeah. I think that's phenomenal.
Yes, it's been really great. And the other thing is I'm not crouched around them anymore. So now I can sit beside Miles and actually help, and with any child, and actually help kind of show them what they need to do. Whereas before I needed to be behind them, giving them all this postural support, and now the chair does it for me, and they can really focus on building the skills that we're trying to work on rather than keeping their balance the entire time.
All right. Jeremy, you're up next.
Okay.
Functional movement training.
So as Tiffany mentioned earlier, my name is Jeremy Wren. I am a physical therapist at our 9th Street clinic. I'm board certified board certified orthopedic specialist, meaning that I just took a little extra coursework and a test to show extra proficiency in more so the musculoskeletal aspect of physical therapy. That being said, I'm not primarily a pediatric therapist. We have Brooke and another therapist who deal with the smaller children, and also the children with more of the developmental delays and disabilities. And so I have the opportunity to work with the children that come in for more of like your sports bumps and bruises and stuff like that. And having children of my own now, I kind of thought back to what the state required sports physical looked like, especially from a movement quality aspect. And speaking with our children's pediatrician, it's pretty surface level. And there's a lot of research out there now that shows movement quality and a way to establish baselines and determine people's readiness can really have a significant impact on the reduction of sports injuries, which is why I requested the equipment such as the functional movement screen, because I would like to partner with some of our providers in the area who perform these physical screens and hopefully make it a little more robust and maybe help some kids reduce their injury risk with also having it not be a financial burden, because there are things like this offered in the greater Willamette Valley area, primarily for cash-based options. And as we all know, medical fees can be kind of hefty, and I don't think that that should be a reason why a child should possibly be at greater risk for sports injury. And so the idea is partnering with our pediatric providers or family medicine providers to get referrals to our clinic if families and children are interested in this, and helping them perform the screen, identifying their baseline capacities, and then providing corrective exercise strategies to, like I said, possibly decrease the risk. And so that's the plan. As everybody also is aware, 2020 really threw lots of things for a loop, and sports was definitely put on the back burner, and how we provided services to people was changed too. So unfortunately, as of right now, we have not been able to implement this program due to some of those constraints, but we are putting that now back in the forefront of some of our projects that we've got going on at our clinic. And we're hoping to roll this out as soon as we can kind of make all the pieces work. So the video that will be shown kind of shows some of the movements and kind of, if the audio works, the people who own the rights to this will kind of give their spiel about it. If not, it's just a really good example to kind of see kind of what type of things it looks like to do the screen.
I believe I fixed the sound, but we'll see. Nod your heads, Jeremy. Perfect.
FMS is your baseline. The functional movement screen is an objective tool that measures 7 fundamental movements that are key to daily life and determines if those movement patterns are optimal, acceptable, or dysfunctional. While the screen is simple and efficient to perform, each test has been strategically selected due to the significant feedback it provides on mobility, stability, and how both work together for larger integrated functional movements. Based on the screen results, FMS professionals can then prioritize exercise and programming to accommodate their clients' needs so they can achieve higher levels of fitness and performance. This highly customized exercise selection protects clients from factors that inhibit progress and produces self-aware clients and athletes who can now reach greater heights in lifelong movement health and vitality. Whether your focus is optimizing training, maximizing client retention, or enhancing communication, Screen helps you get there. It is the foundation for one of our basic beliefs: play to your strengths and work on your weaknesses. Explore our course options and get started today.
Tiffany, did you want us to answer questions as they come up, or did you want us to wait a little while? Because Daryl just had a question that I could more than happily answer.
I'm ready to move into the Q&A if you are. I don't know if you have anything to add from the video.
No, I mean that, they put it pretty well there. Like I said, it is a product of theirs, so they do try to be concise with their advertisement, but it looks at 7 things that we should all be able to do. And if you've got small children at home that are, I hate to use the word normal, but are normally developing without any cognitive disability, they should be able to do all these things. And somewhere along the line, for whatever reason, be it occupationally or sports specificity, we forget how to do things like squatting, lunging, crawling, and those are all things that we shouldn't ever be able to not do, but we find ourselves not being able to do them. And so seeing why those barriers are there, taking them out and allowing them to do that again, can decrease risk of compensation and compensatory injury. So that's what it is. To answer Daryl's question, is the functional movement screen mobile? Can't take it to other locations to reach? Yeah, it's incredibly mobile. It is maybe weighs all of like 5 pounds, can fit in pretty much any car, and can actually be done with multiple groups of people at once. Becomes a little difficult because some of those things, as you saw, do require the equipment. But this is something that's used in professional teams, collegiate teams, larger high schools. So their training staff will do this for the whole team, and then it's able to individually address each athlete's needs to make sure that they're not doing something that puts them at greater risk for injury. But yeah, no, you can take it absolutely anywhere. And yeah, I mean, that's would be eventual intent would be great. Some hoops to jump through would be, some of the partnering with the schools. Their training is kind of already maybe done by local private clinics, and so not impinging on anybody's contractual obligations or whatever. But yeah, no, it'd be super great to travel around to the places that Samaritan's allowed to kind of provide services to, and can definitely do it anywhere.
Wonderful. If you do have a question, you can raise your hand. I am watching that, or drop it into the Q&A, the meeting chat feature. Does anyone else have a question today? All right. Well, Brooke and Jeremy, thank you so much.
I'm sorry, Tiffany, I do have a question. It's just taken me a while.
Go ahead, Daryl.
It's for Brooke. So explain to me, like, if you have a child in the Rifton chair, and then what happens when they graduate from that chair? Are there bigger chairs, or does the chair expand, or how does that work?
So when I was selecting, the short answer is yes, there are different sizes to that chair. When I was selecting the chair, I tried to think of what would fit the greatest need of the population that I have. I do have kids that are too small for it and that are too large for it. And so I still have to use that same creativity that I was using prior to accommodate their seating. The great thing is it is very adjustable. So I'm trying to think. I've put a child who's probably about 2.5 feet tall, 2.5 feet tall, up to a child who is about 4.5 feet tall. And as long as they're under 100 pounds, I can accommodate them for the most part. But yes, there are different sizes. There's an infant size. I got the size 2, but I believe I know it goes up to 1 to 3. I even think there might be a size 4 for adults. And so you can graduate sizes. The other thing is I also tried to pick with what would be the most optimal positioning things, which was the lateral supports and the head support. But there is also additional add-ons that the Rifton chair can come with, and that can be for additional leg support, chest straps. It has a lot of adjustability that can be added on to support even more children. So it is an excellent tool, but it does come in other sizes and with other additions that can make it even more accessible to a larger population.
Great, thank you.
I don't know if
All right,
Brooke,
I do see.
sorry, I don't know if Brooke has access to the chat or can see it, but I'll defer describing the pediatric gym to her because, like I said, I actually treat children from the ages of like 6 is about my lowest to my oldest patient's 95. So I actually don't spend a lot of time in the actual pediatric gym itself, just because we do dedicate it to Brooke and her other pediatric physical therapists, so they can speak to more of the gym aspect of it.
Yes, sure, I'd be happy to. So our pediatric gym is used by myself, the pediatric occupational therapist, Mackenzie Small, the pediatric physical therapist, and also Rowan Bupp, our pediatric speech language pathologist. We alternate days because we have one gym. The equipment there, we have obviously the Rifton Activity Chair. In the video, you could actually see some of our suspended equipment, which is one of our swings. We have 4 swings, and we have them for different functions. We also have a variety of games and some benches and then some mats. And just some toys. We try to, again, our youngest patient I have served is 4 weeks in that clinic. And my oldest patient has been 21 or, oh, I'm sorry, 25, but had the cognitive level of about a 5-year-old. And we also have some stairs that I believe was a grant function. So, and we cater our therapy to each individual child that comes in. The swings, when they are utilized for a variety of things, they can be for vestibular input for regulation. They can be balance and coordination and strengthening. They can be a great motivator for children to get through the other tasks that they need to do in order to get to the swing at the end. Vestibular movement, just as a breakdown, is inner ear stimulation, which can be used for regulation, and also some balance challenges as well. So that's kind of an overview. It is a pretty large space. I also see some questions about servicing children on the coast. Thus far, there is not another pediatric gym on the coast. There is an OT that has been hired on in Lincoln City that I have started talking about potentially servicing some of our kids on the coast, because thus far they all travel to us for pediatric PT, for pediatric speech, and for pediatric OT. We are the closest clinic. So I have children come from Waldport, Newport, Lincoln City, and because we are what services that they come to us. It has actually, we've been working with some telehealth as well to try to limit that commute, because it has been very, very challenging for families. We also do an episodic care model where we try to serve them for 3 to 6 months so that they can have 3 to 6 months off and they're not constantly driving. And then the other question is, would having a larger size chair benefit both the patient and the therapist in injury risk reduction? The answer is yes. It would. It would also be good. Having the larger and the smaller size would be extremely beneficial, because again, kids are not one size fits all, and they do. It would certainly be something to consider in the future. I'd be honored to consider it and pursue this again in the future. But yes, it limits the risk on me. I have a lot less back issues because I'm not reaching and bending over, and the kids are getting a lot more support as well. And also our speech therapist is using it for appropriate positioning for the infants and children that she's feeding. So I think kind of coordinating with her when we're looking at next steps for the size would certainly be helpful. We're using it for our speech therapy children as well. So I think I got all of the questions there.
Yes, I think you did.
Okay.
Any other additional questions? We do have some stretches coming up. We thought it would be fun to have an activity that we could share with all of you today, as some of you might be working remotely and maybe need to get up and stretch a bit. But I see Barb typing, so I want to hold for one last question.
And segue into the stretching, it is so important as you're working from home, as you saw with Miles, to be appropriately positioned. Ergonomics is something I think we very easily take for granted, but you want your body to be appropriately supported for the job that you're doing. You also want to be thinking about your eyes, staring at the screen. You know, do you need to adjust contrast or give your eyes a break? And then what we're going to also present is specialty stretches. So make sure to keep all of those things in mind. And if you have any aches or pains, then, you know, please certainly come and seek us out, and we would love to help work through and do those ergonomics, but we will start you off with some stretches to help that transition if you need it.
Oops. Yeah, before we jump into this, I want to really thank both of you, Brooke and Jeremy, for presenting today. I know you had a lot of prep work to do to get those videos created and found and link them up here, so I really appreciate that. That was one of our goals with doing show and shares, is that it's often we talk about what we're funding. We don't actually get to see what we did fund and how that was beneficial to someone. So that's been so great, and we're really hoping to do more of those. All right, going into some video or stretches here. Jeremy, will you be leading us through these, or?
Yeah, I can definitely talk you through them. These are kind of, I mean, Brooke and I cannot stress enough that we definitely don't take the same approach for every single patient. Everybody's a little different. However, these are probably some of the better overarching generalized stretches that one can do, especially if you're doing a lot of sitting for work. My big plug always is, I was at a conference and anecdotally they were mentioning that, you know, the human body kind of sits in a hip flexed position for like 20 hours out of the day for sleeping positions and commutes and sitting for work and eating for meals and watching television and stuff like that. And people get all upset when they're, but I go to the gym and it's like, yeah, but the 24 hour or the 23 hours of the day that you weren't doing anything isn't like made up by the 1 hour of the day that you were. And keeping that kind of stuff in mind, because the body ultimately was made to move. And society has kind of moved us to a different type of occupation. So this first one is a hamstring stretch, posterior chain. So if you're like a walker or a runner, it's definitely important to keep the your general lower extremity mobility kind of up to snuff. This one is a pretty good one you can do sitting. It's a little more gentle. The big clinical pearl I have for this one is to definitely think about accessing the motion from your waist and not necessarily just bending forward, kind of almost like a seated bow with one of your legs more extended. And with every stretch, you kind of want to play and flirt with discomfort, but you definitely don't want to make it painful. And so this, you know, might feel that stretchy pain, but definitely don't try to make yourself a contortionist and push yourself, because this is not a no pain, no gain situation. Also, not to get lost in the weeds, but roughly research shows you want to hold about 60 seconds in total, not necessarily all at once, but to get some structural changes. And so that's why it's about 3 repetitions of 10 to 15 seconds. You can go upwards or downwards, but you want to shoot for that in total 60 seconds. So the next one is a seated hip flexor stretch. The woman actually here, this is a great if you're pregnant, this is a nice substitute for kind of your typical maybe side of the bed one or kneeling one. So you kind of sit towards the edge of a chair and get in this lunging position, and the leg that you're stretching is, the muscles that you're stretching are in the front of that back leg, not the one that is the knee bent, the one with the knee straight. It's going to be kind of stretching in that hip groin area. The next one. So this is a good one for upper extremity mobility, because if you're not bringing your arms overhead a lot throughout your day because you're doing a lot of typing or anything else, you can get rounded, you can get that kind of hunched over look. And so this helps kind of your mid back as well as your shoulders to be more upright. Lots of things can go south if you are in a forward flexed hunched position, neck, mid back, shoulder, you name it. Sitting kind of in that really forward flexed position is not always conducive. And so a couple times out of the day, taking a break and kind of going up overhead and stretching out those areas. And so you're just kind of sliding your hands up the wall, going back down, whatever's comfortable, but keeping those mobile. This one probably looks familiar to a lot of people, posterior capsule stretch. This one would be super nerdy therapist type stuff, but if that area of your shoulder is not mobile enough, you can get into some problems with how your shoulder blade and your arm bone, your humerus move together, which can cause some pinching and discomfort of your shoulder with activities, and even possibly, if it goes on long enough, like degenerative rotator cuff tears. So making sure that the shoulder in and of itself is mobile enough so it can move well and decrease your risk of any future injury. And then the last one is this one says Pec Major Stretch. It's more of your anterior chest. And so with, once again, kind of typing everything, we get all hunched over. The muscles that attach from your kind of front of your rib cage to your shoulder blade and arm can get tight if they're in there for a long period of time. And so going to a corner or a doorway and kind of opening yourself up, and you'll really feel almost like your ribs or your chest expanding, will help to avoid all of the hours spent in the opposite position. Kind of like I said, these are nice mobility and things that you can do as easy rest breaks, either in your home or in the office, and people won't look at you too weird. But there's also a huge strength component that goes into this. Like, as I said, body was made to move, and sitting is not conducive to that. And so I can't stress enough the importance of, if you're a Samaritan employee, using your wellness benefits and taking those opportunities, take advantage of those opportunities, and moving. I think American College of Sports Medicine is 30 minutes of activity a day, and walking's great, but you got to walk a little faster, get that heart rate up. So, you know, give yourself a half hour at least a daily, because your body is like a bank account, and eventually Father Time will make its withdrawals. So deposit a lot while you have the ability to.
Very good notes. And I know I was adjusting my posture even just watching this as I've been sitting here for a
always
while
does
today.
here. This talks about posture.
Yes, thank you both so much. And yeah, these are very great stretches that we can incorporate into our lives. And I love that they're sitting and wall ones, so nothing too strange if you're in an office environment.
Yeah.
Yeah, very applicable.
Yeah.
All right. Thank you all of you that have joined as guests today as well. We love seeing you. And we hope you can join us for our next WISH event. Stay tuned for more. We'll be sending out communications in the next coming months. All right. Thank you, guys.
Thank you.
Thank you.
Thank you.
Thank you.
Thanks, Tiffany.
Thank you.